Hey, Dr. Gullberg here, continuing our internal medicine lecture series. Today we're talking about Parkinson's disease. Let's talk about the clinical features of Parkinson's disease, and then let's talk about some of the treatments of Parkinson's disease. There's four cardinal motor symptoms of Parkinson's disease. Number one is obviously tremor. Number two is rigidity. Number three is slowness of movement, or bradykinesia. And number four is postural instability or impaired balance. Also look for something called festination, which is shuffling gait, a forward flexed posture when walking, micrographia or decrease in size of the handwriting, and a mask-like facies. These are all pretty typical. Unfortunately, patients with Parkinson's disease can also have neuropsychiatric problems, mild to severe. Look for disorders of speech, behavior, mood, and thought. So what are the kind of treatments that we use for Parkinson's? Well, obviously we use dopaminergic agents, L-Dopa or levodopa. Unfortunately, only 5 to 10% crosses the the blood-brain barrier. So carbidopa, which is dopa decarboxylase inhibitors, augments L-Dopa and prevents peripheral conversion to dopamine. So dopamine isn't active really, except for some of its side effects, which can be a problem. Some of the meds that we use are Compton, which is a catechol O-methyltransferase agent. It increases our L-Dopa levels. Dopamine agonists, which bind to dopaminergic post-receptors in our L-Dopa-like. These include Maripex, Requip, and now the Nupro patch. These are the most common agents used. MAO inhibitors such as Aldopril or selegiline blocks the breakdown of dopamine in the basal ganglia. The science of using drugs like Sinemet and these other medications is very complex, and there's obviously specialists in Parkinson's disease that take care of our Parkinson's patients that are hard to, treat. For patients who don't respond to these treatments, there's other things such as deep brain stimulation, which are electric wires that stimulate the basal ganglia. Very complex procedure, but can be very helpful. So hopefully this gives you a nice little summary of Parkinson's disease, what kind of look for, and then the meds that we use to treat it. Thanks, Dr. Gullberg, signing off.